Hey everyone, welcome back to the Daily Apple, the great podcast with a stupid name. I just can't. Today I'm joined by Dr. Ash Goyle, double board certified in anesthesiology and pain medicine, trained at the Cleveland Clinic, someone who spent nearly 2 decades on the front lines of chronic pain and modern healthcare, and really on the cutting edge. What makes Dr. Gould different is that he doesn't just treat pain, he asks why there's pain in the first place. And today we're going to talk about why so many people are hurting earlier than ever, why most doctors miss, or what most doctors miss, and what actually works if you want to stay strong, active, pain-free as you age. Dr. Goyle is really on the cutting edge. We're going to cut into exosomes and all that kind of stuff. He's very knowledgeable in that, which was very impressive. One of the first times I met you, you were just a wealth of knowledge, more than anybody I'd ever known in that space. So that was kind of cool. So I appreciate you being here. And did I get that right? Is there anything else I should add about you, man? I'm sure there is.
Hey, man, that's a lot. And thank you very much for the kind introduction. And it's truly an honor and a pleasure to be here, Kevin.
Yeah. Thanks for your time. So yeah, before we get into anything, I mean, we were just talking about red light therapy and the shift wave chair. We're kind of going to veer off right off the bat, but tell me about this shift wave. I mean, we may cut this out, but I do want to
Yeah.
know about this. Now I'm just kind of wanting to know.
Great, let's talk about it. So, one of the things that's foundational for, I think, health in general is balancing our nervous system. So many of us are in a fight or flight state. So that's a sympathetically driven system. So the lion's chasing us and we're in survival mode, right? Most of us live in that space, especially, if we're working our jobs, where we have families. There's constant stress put upon us to produce, to make money, to survive. Well, our most profound healing happens when our sympathetic nervous system is balanced by the parasympathetic nervous system. So that's the other side of our nervous system. That is our rest and relaxation mode, right? That's our rest and digest mode. That's where our body repairs itself. And that's where the most amount of stem cells get released. This happens tremendously during our deep rest or deep sleep. And there aren't very many tools out there that people are aware of to balance their nervous systems. There are some really simple things like breath work. That's incredibly important. We have the ability to control our nervous system. We can change neurotransmitter levels in our bodies just through doing different types of breath work, right? And meditation, prayer, all that stuff is a form of balancing our nervous system. Well, there's something called a shift wave. So this is a zero gravity chair where they've combined mechanical and vibrational technology into this chair, along with guided or unguided meditation and blackout blinds, so you can't see, it's all sensory. And you do different types of breathing, Wim Hof, Kundalini, all these different types of breath work while you're in the chair. And there's vibro mechanical technology happening from the right to the left, from the top to the bottom. It comes in waves, and it's designed to balance your sympathetic and parasympathetic nervous system while you do this intense breath work. And the sessions, so you have the shift wave chair. It's got a pulse oximeter that measures your heart rate, your oxygen levels, and then it calculates your heart rate variability while you're doing these meditations. They've got programs ranging from 5 minutes all the way up to an hour. They've got protocols for inner performance, protocols for rest and relaxation, protocols for regeneration, protocols for sleep. They have children's protocols. This shift wave has been used now for several years. The Navy SEALs are known for using this to really balance their sympathetic and parasympathetic nervous systems. They're using this in the elite athlete world. U.S. Olympic athletes are using this chair for performance, for recovery. It's in the NFL. It's also used with our soldiers in Ukraine. Shiftwave has also been introduced to the firefighting community to help them balance the stress of their intense job. I can't even imagine what they see on a daily basis and the situations they're put in. But it's designed to help balance your nervous system so we can process all the sensory input that comes into us on a daily basis. I've found it to be incredibly beneficial for myself. As far as performance, as far as sleep, as far as recovery. So it's something you can use before a workout. It's something you can use after a workout. It's something you can use first thing in the morning. It's something that you can use in the evening before you go to bed. They've got some really deep meditation, guided meditation protocols that you can do that really get you into those deeper states of theta wave brain activity.
Mm.
I find it helps with focus, mental clarity, and it's become my new favorite health tool, if you will. They say it's not a health tool, but there's so many health benefits with this thing. I think we're just touching the tip of the iceberg. They're using it for PTSD, for traumatic brain injury. So with the vibrational technology, so it's vibrating throughout your entire body, and it comes in rhythms and waves, and there's all algorithms based on neuroscience. Like the scientist who created this is a PhD in neuroscience, and I think he's absolutely brilliant. And there's a lot of data on this chair now showing its benefits for on a molecular and cellular level.
Yeah.
But yeah, I've just found it to be an incredible tool for myself. If you want to look it up, is Shift Wave, SHIFT Wave, WAVE. And if you just Google it on YouTube, you'll find short clips and videos of people using this. Ben Greenfield. A lot
Yeah.
of people are familiar with Ben Greenfield and, his extraordinary athleticism and, his willingness to explore
Oh, yeah.
different modalities to make himself superhuman.
Yeah. How long are you in it? What's it feel like? Are you just, uh,
Anywhere from 5 minutes up to an hour. The vibrations, I mean, so you have a dial. You can dial up the intensity or dial it down
mhm.
depending on how intense you want to feel the vibrations. For me, I like more. I'm more is better kind of guy, so I
Yeah.
like the intense vibrations. But what it's doing is also draining. It's helping your lymphatic system.
Hmm.
So a lot of us have sedentary lifestyles. I mean, yeah, we work out, we take care of ourselves, we exercise, but maybe not as often as we should.
Hmm.
I feel like this has the effect of helping lymphatic flow throughout our body. If you want to get a little deeper with the way the rhythms are set up, it actually helps CSF flow, your cerebrospinal fluid flow from the brain all the way down to the sacrum. Some of us are familiar with the glymphatic system. This
Yeah.
is a special lymphatic system in our brain, exactly how we drain senescent cells and get toxins out of our body. This kind of accelerates that process. It's got programs where it can actually mimic deep sleep. So you're awake, you're doing the breath work, the guided meditations, but your body is in a state of deep sleep at the same time. It's incredible. It feels like in the chair it's vibrating, you're breathing. It feels a lot more intense in the chair than it looks like. If you're watching someone in the chair, you can barely see the vibrations, but when you're in the chair, your whole body's shaking.
You're in.
But but it's you can control the intensity. For me, I like that intensity up pretty high. So when you're doing the breath work, time flies when you're in the chair. It really does. Most people get up and it's a feeling of wow.
Yeah.
So if you watch the YouTube videos, even 5 minutes in the chair, you get up and you're just like wow, because it puts you in a state of clarity and calmness and alertness all at the same time.
So you
It's
have this,
natural.
yeah. Do you have
Yeah.
this in your office? Do you let your patients, you just, if they're having a headache or something, yeah, you just go sit in the stem chair for a while.
Well, you know what? We don't have it in the office yet because that was the original plan, but I love it so much. I use it almost every day,
Right.
and I want it here on the weekends. So we'll eventually get one for the office.
Right.
But
Right.
I combine it with the red light therapy. So we have a red light panel, so I'll combine that with that. We do have a red light panel in our office,
Hmm.
a full body red light panel. So we offer that complimentary to our clients when they come in. Sometimes while they're doing IV hydration, like a Myers cocktail, if they just want to put the goggles on, lay back, and not watch TV or play on their phones or read a book, then we'll bring it in and use the red light therapy for them. We do a lot of photobiomodulation in our practice. We have a class 4 MLS laser. This is a multi-wave locked system laser, so it has two different wavelengths of light. 808 nanometers and 905 nanometers. The 808 nanometer frequency is continuous, and what that does is it stimulates release of growth factors, VEGF, it recruits stem cells to the area, causes vasodilation, and promotes tissue repair and healing.
Now this is your, and we've switched gears. This is your laser.
This is our laser. Yeah, now we're switching gears to
Yeah.
photobiomodulation.
Now we're talking about pain and all that stuff,
Pain
right?
and
Which is
tissue
kind of
repair
your,
regeneration. Yeah.
yeah. Okay. Yeah, go ahead. Yeah. So what do you use? Yeah, I saw this and I was at
Oh
your
yeah.
office and I got
Yep.
to see what was, how the sausage was made a little bit and which was cool. But yeah, that laser is pretty awesome what you're doing with that. So I guess we should go through, I want to come to that, but I mean, take me through like what a patient experience is like. Because the thing that was really interesting about your practice and the way you see it, a lot of this is you do a lot of spine, joints, chronic pain and all that, and you use exosomes, you do specific treatment modality, and kind of take me through that. And we've been looking at sending some patients your way. You're in Scottsdale for
Hmm.
anybody listening, but which is a sweet little area. And the way you view the whole care plan is not just the procedure, it's the whole thing, like pre and post, and who you'll treat and who you won't. They have to be dialed in to make the best outcome. And you're really mindful about that. So I guess take me through that whole, what that looks like.
Okay, I'll give you a little bit of background.
Yeah.
As you mentioned, I did my anesthesiology residency at Cleveland Clinic. And
Yeah.
then the year after my residency, so from 2006, 2007, I did an interventional spine and pain fellowship at
Yeah.
Cleveland Clinic. And so, what that is for people who don't know, that is where we help people manage acute or chronic pain of the musculoskeletal system, so joint pain, or spine pain, neck pain. We also, at Cleveland Clinic, we managed everything: neuropathy, abdominal pain, head pain, you name it. If you had any kind of pain, we were seeing you at the Cleveland Clinic, which was phenomenal training. Like, I got to work with 10 of the top pain docs in the entire world. It was a very busy fellowship, performed thousands of procedures before I left my fellowship. And we were very good. It's a program that's set up to really interrupt pain signals, right? And so I got very, very good at that. And I did that for 10 years of my career. So 2007 to 2017, I was very good at shutting pain signals off, either with cortisone, radiofrequency ablation procedures, with medications, with spinal cord stimulators, intrathecal pumps. I did it all. In 2017, I went to a conference, a pain conference, and the first day of that conference was dedicated to a field of medicine called regenerative medicine. This is something I knew very little about, but in that one day, my entire philosophy of how I approach pain completely changed. There, I learned that the body has its own healing mechanisms, and we can harness those because sometimes the body can't do enough. Like when we have chronic knee pain, we're not getting enough of what we need to overcome that pain with our own body, right? So we look for outside sources, physical therapy, cortisone injections, gel injections, and then eventually maybe surgery. Well, in this one day, I learned that elite athletes were going to Germany to get some special sauce put in their knee, and that special sauce came from their own bodies. And that we have the ability to concentrate our own growth factors, anti inflammatory proteins, our stem cells, and as you mentioned earlier, our own exosomes.
Yeah.
All of these have the effect of not only relieving pain and inflammation, but also allowing for tissue repair.
Mm.
So this blew my mind. I went back after that course, and I was like, this is what I want to do for the rest of my life. Like, so I wanted to reinvent myself as a specialist in this field. And so I traveled the country, found mentors who have been doing this for years. I shadowed them in their clinics. I read tons of articles, began going to conferences, and making friends with the world's experts in this field. And now they become my friends, which is tremendous. But in 2021, I opened up my own practice. So I left my corporate medicine group, which was, like I said, we were a pain practice focused on managing pain.
Yeah.
2021, I opened up my own practice, Integrated Spine Pain and Wellness in Scottsdale, Arizona, with the vision of helping people holistically, like whole body management. Because what we're learning is that osteoarthritis of the knee isn't just a knee issue, it's a whole systemic issue.
Yeah.
What's happening, Kevin, is that our joints wear down over time because the ability to repair that tissue, it can't keep up with the wear and tear. So we call that catabolism versus anabolism, right? When we're in our teenage years, like, young athletes, they'll injure themselves. They heal really fast, because we have a robust amount of stem cells. These exosomes, our natural peptides in our body are so robust that we can actually heal our tissues. But as we age, that repair mechanism starts to slow down, right?
Hmm.
So factors that are involved with that are the foods we eat, our lifestyles. What we put in our body creates every cell in our body. And that gets ignored. That's not taught in medical school. That wasn't taught to me in fellowship. We weren't taught how to create a healthy spine, right? That's what I learned from that one day, that one conference in 2017. That's when I started to become aware of spine health, of joint health. and how it's not just localized to that one area or this one area. It's the entire system that's involved, where this includes, like I was telling you earlier, about the sympathetic and parasympathetic nervous systems getting back. It's about the foods we eat. It's about exercise. Sleep is incredibly important. So now I've incorporated all of these into one modality that I call it the G-force method. But how the G-force method works is someone will come to me either by a referral from their primary care specialist, their physical therapist, their naturopath, their surgeon, or word of mouth from friends and family that I've treated in the past. We'll do a consultation. And the consultations I do are 1 full hour, right? Because I need the time to hear their story. I mean, it's all about, people will tell you what they need and what their issue is if you just sit down and listen to them. So I'm blessed to have the practice where I can afford to spend 1 hour with each client on the initial visit. And I take in their history, like, what's the issue? For example, if it's back pain, when did it start? How long has it been going on for? What have you done in the past to help manage this and control it? What's worked? What hasn't worked? How is your sleep? How is your diet? What supplements are you taking? What are your hobbies? What do you like to do outside of work? What kind of work do you do? All of that matters. So I take that whole intake. We'll look at images if we have images, x-rays, MRIs, CT scans, whatever we have available to us. Then I do a full physical examination. Because I tell people, when you come in with back pain, there are likely other issues going on. So we do a full musculoskeletal and neuro examination, and then I start putting it together. Then it's like, okay, we want to start out with foundational health. A lot of people who come to me from their concierge primary care specialists who are functional medicine trained or integrative. They're either one or the other. It tends to kind of who I attract to my practice. So a lot of the foundational work has been done, right? And this is nutrition, this is diet, this is improving gut health. This is improving sleep hygiene. So a lot of people come to me in that process or already teed up for this. But that's the foundation. If they haven't done that work, then I coordinate with the primary care specialist or the naturopath to really look at labs and then say, hey, look, we need to get the inflammatory markers down because we're considering a biologic treatment, right? So in my practice, I do a lot of these what we call orthobiologic procedures, where I take your own stem cells, I take your own platelets, your own growth factors, your own exosomes, your own peptides, I concentrate them and then deliver them with precision and accuracy under X-ray guidance or ultrasound guidance to exactly where they need to go. And it's a comprehensive treatment. But before we get to that part, people need to understand that with these regenerative medicine procedures, you're making the stuff we're going to be injecting back into you. So you want to make me, well, you're the pharmacy that's making me the drug I'm going to be putting back into you, so make me a good drug.
Yeah.
And how do you do that? It starts with food and foundational medicine. So that's all the functional medicine stuff that you're very familiar with. But it all starts with that. And then we add movement. Then we add the mindset piece. Then we add, sleep hygiene and meditation and balancing the nervous system. So we have all these tools available to us. And a lot of these are free. They're just, it's just a matter of, I'll give people a guideline if they don't have one already. Be like, here's simple breath work you can do. Takes 5 minutes, do it every morning, do it every night. And then once you're bored with that and you're like 5 minutes isn't long enough, you're going to want to do 10 minutes. And then you're going to want to do 20 minutes because you start to feel so good. In the morning, it's like natural coffee, in the evening, it's like natural ambient, so, and it's free. It just takes a little bit of time out of your day. But these are the kind of things we look at that I think that most pain management specialists aren't doing. And it's not their fault. It's just that the insurance-based medical system limits your time. I came from that system where I was seeing 30, 40 people a day and doing 150 shots a week, and it was just a mill of people, right? you know, with the practice I have now, I can afford people time, and it's like we look at everything holistically because everything is connected. If someone has a knee issue, there may be a contralateral hip issue, there could be a back issue, could be a neck issue, and we want to see everything and how it's related. Could be related to the stress of someone's job. Obviously that can't change, the job can't change, but we can change how we manage stress. So we want to optimize a person as much as possible because it's not only what they're making me to inject, it's also the environment I'm injecting their biology into, right? So there's two key components there. So you're making me a substrate, but I'm also putting it back into an environment that we
Mhm.
want to optimize. So you have the best chance of success.
So, because they're spending the time and money to do it, so need to make it really count.
Exactly. Yeah.
Yeah, I love the way you think about it as opposed to just doing the procedure alone. I was expecting we'd be talking about procedures, but you went into this whole thing prior and like, well, duh, absolutely. If I'm going to fly to Scottsdale and do all this stuff, let's make it worthwhile. So tell
Hmm.
me I mean, you've got the procedure itself, like say, I mean, do you see a lot of spine stuff?
I do.
C spine and all that. But tell me about what are some common things that you see with the spine that you do and the interventions you do and the right kind of people that get you that good environment to work in by doing the work prior. What does that look like? What are you doing? There's so many other layers of your procedure.
For sure. Great question, Kevin. In traditional pain management, like the way I was taught, the way insurance tells us to do what we do, the way we do it, someone comes in with back pain and let's say sciatic pain, pain going down the leg.
Yeah.
We target the one or two nerve roots that are contributing to that pain with cortisone, right? Because the goal is to shut off the inflammation, right? It does nothing to heal the issue. It does nothing to help the spine. It's kind of like a whack-a-mole with inflammation in that area, which is there's a place for that. I've done tens of thousands of those procedures in my career. With biologics, it's a whole different approach. It's a whole different mindset. It's a whole different field of medicine. It's a whole different way of looking at the spine. So when someone comes in with back pain, let's say they have radiating pain down the leg, in the absence of any weakness or any major neurological deficit, then they're a potential candidate for these biologic therapies. Some people just need surgery. I've got people who come in, they have full blown foot drop, they can't move their foot.
Yeah.
Like biologics are not going to help that. Like that's when I'll pick up the phone and get you to a neurosurgeon and you get that nerve decompressed, that disc taken off that nerve. And then we can follow it up with biologics to accelerate the healing process. And then we talk about tools to prevent this from happening again.
Right.
But you come to me, low back pain, pain going down the leg, instead of just treating those two nerve roots where that disc issue is, we do what's called a functional spinal unit approach, where we're looking at the entire structure of the spine, above and below, and all the factors that are going into what created that instability to cause that disc to give out, right? Something happened there. The disc giving out, the herniated disc isn't the root cause of the issue. The root cause is what caused the instability, what caused the difference in forces on that particular disc to cause it to rupture, right?
Yeah.
That's what we look at. So when we do these biologic treatments, I'm treating the level above, the facet joints. These are the joints in the spine that allow us for motion and wiggling. We have joints in our spine, like we have joints everywhere else in our body. Those joints can become arthritic. So I inject the biologic, whether it's stem cells, whether it's PRP, whether it's exosomes or your own peptides, anti-inflammatory proteins. I'll put those inside the joint capsule in the ligaments. So we have interspinous ligaments, we have supraspinous ligaments. Ligaments are these dense bands of tissue that keep the bone and the joint stable.
Mm.
Right? We have ligaments like everyone's heard of an ACL, an anterior cruciate ligament in your knee. That provides stability to the knee. Well, these ligaments are really, really tough and they're hard to break. So when you tear your ACL, that's a really bad injury there. But you can have the same type of thing happen in the spine. And over time, these ligaments start to get loosey-goosey. You can think of ligaments like the rubber band that holds broccoli together at the grocery store, that thick blue rubber band, and it's really dense and tight. Well,
Yeah.
those are like our ligaments. But over time, those ligaments get loosey goosey, right? We have no tools to strengthen ligaments, give ligament to support. So when they get loosey goosey, they can cause that excess pressure on one side of the disc or the other, and then you can have the forces or that one moment where the proverbial straw that broke the camel's back,
Yeah.
causing that disc to collapse and herniate out. So what we do with these biologics is we inject the ligaments because the goal is to get those ligaments from loosey goosey back to that broccoli rubber band type of really dense, thick, healthy tissue again. And we've seen from decades of data that does happen. So I also treat what's called the iliolumbar ligament, which is a major ligament that stabilizes the back and the pelvis, the sacroiliac ligaments. I also treat the epidural space. People have heard about getting epidural injections. Epidural is the space around the nerves. We can put the biologics in that area, and what it does there is it reduces inflammation, which can reduce pain, but it also changes the microenvironment of the spine. So everyone has heard of degenerative disc disease, I assume. So that's just normal wear and tear of our bodies and our spine. Well, what happens, you got to think of this like as a smoldering fire, right? And it's like this constant smoke that's getting released. Well, that smoke is toxic to those discs and it wears away the outer layer of the disc and it causes degeneration where the disc becomes dehydrated, it becomes less pliable, and it starts to shrink. So that's when people are like, oh, I got bone on bone in my back. That's an advanced degenerative disc situation. Well, we've learned from decades of doing these procedures now that when we inject the biologics into the spine, we change that environment from one of tissue breaking down to one of tissue building up. We can't regenerate the discs, but we can regenerate some of the tissues around there to make it healthier. We've actually, at least in my practice, that we've seen on MRI studies, 2 years after these procedures, the disc has become rehydrated. So what that means is it's actually become healthier. It
Mm-hmm.
hasn't grown. We're not really seeing discs grow, but we're seeing discs become healthier. And what that does is it gives you better function in your spine. So with these procedures, it's not only pain relieving, but it's also improving the health of the spine.
Yeah.
So it's a comprehensive treatment. Some of these procedures for the spine that I do are 40 injections. You are sedated. I am an anesthesiologist, so I keep my clients sedated, very comfortable on the table.
Yeah.
Most people don't even remember having anything done, which is amazing.
Yeah.
But we also treat the muscles that support the spine. One thing that often gets overlooked with spinal health and chronic back pain are the muscles, the multifidi muscles, the quadratus lumborum, these deep muscles that actually form part of our core. When people think of core, they always think the abdominal muscles, the obliques, but
Right.
then you have all the back muscles. You got the iliocostalis, longissimus thoracis, you got the multifidi muscle. All those muscles form, that's all part of the core that stabilizes the spine.
Mm-hmm.
If you look deeply at some MRIs and people who have chronic low back pain, you'll see that they've got some atrophy of those muscles. So under ultrasound, I'll find those atrophied areas and I'll inject a combination of your own exosomes, peptides, growth factors directly into those muscles to ideally reverse that atrophy over time. So it's truly a comprehensive approach. So I see people with spinal stenosis. Obviously, if they've got some neurological conditions, this is not a you're not a candidate. But if it's the pain that's limiting you, then they might be a candidate for these types of procedures. People who have just normal wear and tear of their back, neck pain, mid back pain, low back pain, I can treat the entire spine. That's my specialty. But we can use a combination of bone marrow stem cells, PRP, something which is platelet-rich plasma, which we take from your blood, something called platelet-poor plasma, which we also take from your blood. It's just low platelet count. It's also full of growth factors, anti-inflammatory proteins.
Mm-hmm.
Something called autologous conditioned serum. This is what a lot of athletes have done. So it's what Kobe Bryant, the late great Kobe Bryant, went to Germany to have done. And
Yeah.
it's me that saved his career. No surgery, no pills, no downtime. I'm one of eight
Not
doctors.
expected. What was that again that he did?
It's called regenokine. Yeah.
You've talked about
Yeah.
it. Yeah, go ahead.
Yeah, it's autologous conditioned serum. Yeah, I'm one of eight doctors in the country who can do this, the only doctor in Arizona.
Yeah.
But it's a way we just take the blood. We have a special way to process it, and what we do with that is it basically creates a serum that's rich in exosomes, like we were mentioning earlier,
Mm-hmm.
peptides, growth factors, and profound anti-inflammatory proteins. One of which, interleukin one receptor antagonist protein, IRAP. I tell people that's your body's natural cortisone.
Yeah.
We can concentrate that by 50 to 100 times what it normally is in our body. And I can put it in a small volume and put it inside a joint. I can put it around a nerve. I can put it around a disc. I can put it into a muscle, wherever you need it. And it's profoundly anti-inflammatory. But along with that are the growth factors, peptides, and exosomes, which help tissues heal and repair.
And it's an IL-6 blocker.
It is an IL-6 blocker.
And for our
Exactly.
listeners, I mean, IL-6 is a really inflammatory cytokine that creeps
Exactly.
up anytime you have anything going on
And
inflammatory wise. Yeah.
right, and same thing with interleukin 1 as well, TNF alpha. These are all pro inflammatory chemicals that our bodies make naturally. And they're usually made in some kind of defense mechanism. But when we have a chronic condition, the defense mechanism has gone awry and we're just constantly secreting these. And, when people come to me, they're like, let's say in their mid 70s, like no history of back pain. They're like, oh, my pain started about a year ago.
Yeah.
I'm a golfer, but I've been working out my whole life and never had any issues. But now it's like I'm playing golf, my back's killing me. We
Hmm.
get an MRI, we see multi-level disc degeneration, right? But nothing acute. There's like no ligament tear or anything like that. There's no herniated discs. And it really baffles people. They're like, well, this just started a year ago, and you're telling me that this degeneration has been there for 20 years? Started 20 years ago. I'm like, it did. But the thing is, it started with these minor micro traumas that we create, and we just didn't give the body what it needs to overcome that. And so our body constantly releases these inflammatory mediators, these inflammatory proteins, and that those proteins are like that smoldering fire with the smoke that kind of eats away the tissues slowly over time, over decades. And then you get to the point where you're mid 70s and all of a sudden you start having these back issues that you
Yeah.
never had before,
Hey,
right?
if you were, if you're looking at somebody like that and you can dial it back to when they're 50s or 40s, what would you wish everyone would do to avoid chronic? I mean, because that's so ubiquitous. I mean, everyone's got some degree of that. What what are things that you would say, hey, everyone needs to be doing like these three things? I mean, to just let's just avoid that. Or I mean, what do
Yeah,
you do yourself? I mean, do you look at stuff differently? You know
for
yourself
sure
as
I
you
do.
yeah.
Yeah, I'll give you my own example. Like my C5-6 is really messed up. I've got advanced degenerative disc disease at that level, severe foraminal stenosis. If you look at an MRI, my sixth nerve is impinged. Luckily, I just have maybe just a little bit of a sensory change right here in my thumb. But it's one of those things where before I saw the MRI, I didn't really have pain, but then I got the MRI. I'm like, oh, maybe I got some neck pain issues now. But I used to lift stupid heavy weights. I started wrestling when I was 13, and looking back, I learned to lift weights by watching other people lift weights. Right. I didn't have there was no one who was telling me this is proper form. This is how you do this. This is all about just putting up the weight and just getting stronger and getting that number higher and getting bigger and, all that stuff. So I did that for 20 years, right? It wasn't until I came to Arizona in 2008 and I started working with a really good personal trainer who was like, hey man, when you're working out, you're leaning to the left. I'm like, no, I'm not. I feel perfectly balanced. Well, then he balanced me out, and I felt like I was leaning way over to the right. And he's like, that's balance for you. I'm like, oh man, I've been working out all wrong. I've been compensating, creating dysfunction. I have a bad left knee too. I got one area of my knee where there's pretty advanced osteoarthritis. What I wish I would have known, or what I would recommend is if you're into working out and exercising, find someone who's an expert in biomechanics, and have them observe what you're doing and how you're doing and have them correct it. Like if you're in a situation where you can work with a personal trainer, highly recommend working with a personal trainer. But I'd even go a step beyond that and work with a physical therapist,
Hmm.
someone who's got a doctorate of physical therapy
Hmm.
and really have them assess your biomechanics. Like a lot of my clients, they'll go to physical therapy, they'll come back and say it didn't work. And that makes no sense to me. It's like, no, no, it's not that the physical therapy didn't work. It's the fact that you went to a facility or a practice where the physical therapist is under so much pressure to see six people an hour. They've got to give you a cookie cutter protocol to check off the boxes for the insurance companies, and they can't give you what you need. I mean, I've got some extraordinary physical therapists who are stuck in that system.
Yeah.
It's like, oh my gosh, if you were just to leave that system and do one-on-one concierge physical therapy, you'd be so much happier. You'd be able to shine and you would transform people's lives because you're so good at what you do, even in that crazy environment.
Hmm.
But if you have the ability to see a concierge physical therapist,
Yeah. And
have
they're
them
out
assess
there.
you.
Yeah.
They're out there everywhere. That's one of my biggest referral sources right
Yeah.
now.
Yeah, me too.
Our concierge physical therapists who are like, listen, we will do everything we can with function, but we need structural support too. And that's where I come into play. I deliver the biologics into the tendons, into the ligaments, into the joint space, wherever they're needed to get that structure to be more stable and function better. It's all about optimal function. But I think that would be something I would highly recommend. Diet is the biggest part of this, Kevin. I wish someone would have told me in my 20s, like, don't eat that large meat lovers Pizza Hut pizza by yourself. Like, you're not doing anything good for your body, you know. But that was my diet back then. Like, I could put one of those suckers down all by
Yeah.
myself, and I mean, I
Yeah.
was lifting weights and working out, and in good
That's
shape.
good.
But it's like that's not doing anything for my joint health or my spine health, right? Luckily, we have the metabolism to break all that stuff down and take whatever nutrients are in there, if there are any.
Yeah.
I would say, listen, focus on foundational health, diet. That's something everyone can do. Really think about what you're putting into your body. Now, I believe in the 80-20 rule. So 80% of the time, eat clean, eat healthy, avoid alcohol. 20% of the time, be normal,
Yeah.
but
Well,
be normal
instead,
within reason.
yeah.
If you care about your body, treat it like like it's your temple, and feed it well. So that's number two. So working out with a concierge physical therapist or a personal trainer and learning proper biomechanics before you injure yourself, I think is ideal. And then number two, food. I'd say food is actually first. I think food's the most important. And then sleep. I mean, sleep is really, really incredibly important for our body to repair and heal.
Yeah.
Like that's when our massive amount of stem cells get released from our bone marrow into circulation. They go searching for homing signals that we have. We have certain growth factors that serve as homing signals. Platelet-derived growth factor B
Say,
is one of those.
say that again. So I'm
Yeah,
going to make you start.
yeah,
And you said this before when we were visiting before, the majority of stem cells are released into the system whenever we're in sleep, whenever
yeah,
we're
yeah,
sleeping well.
right. Unless there's an injury. If you
Yeah.
have an injury, then you're going to get that massive release too. Inflammation is a trigger for that.
Yeah.
So, and if you have chronic inflammation in your body, when you're in stages of deep sleep,
Hmm.
your stem cells get released. And that's when your body's repairing. That's when your parasympathetic nervous system is really revved up. And that's when your body's in a system of repair. So those stem cells are looking for homing signals. Inflammation is one of those signals. There's growth factors, one in particular, platelet-derived growth factor BB is a homing signal, and that's released from platelets. And the stem cells go and they do their tissue repair at night. Sleep hygiene is incredibly important. Those are three things that people can do. One will cost some money. The other is just being more mindful about what you put in your mouth and what's at the end of your fork. And then the other one is free, sleep hygiene. There are plenty of tricks and tools out there that are not drug based to help you sleep. And I would say invest in sleep, good food, and really learning how your body works so you don't injure it. And that's prevention right there, right? And that's all the foundational stuff I do for the biologics.
And and I'll make a point on the biologics. After we talk, you're really intricately involved in that process. You don't have a tech or any, I mean, you're in there making sure that you're very hands-on in in the back, on the back end of that kind of stuff. So whenever people are getting their stuff, getting ready to roll, it's got the good Dr. Goyle's hands all over it. So
And that could be to my detriment, my mental health detriment. But at the same time, I'm a Virgo, I'm OCD.
yeah,
And I tell people with these biologic therapies, it's not cookie cutter.
yeah,
Like, I'm not doing the same thing twice ever. It's completely new and completely fresh for every single person I'm treating because everyone is a unique organism with their own unique issues, right? So for one person, I may take a little bit more bone marrow. I may change the centrifuge speed. I may change the centrifuge time to really concentrate them down because we have one area where I really need to hit a home run with this. I want this one issue here. Really need to address that. I change the volumes I use. I mean, it's so personalized for every single patient. I think I call it the three P's. It's personalized, participatory, and predictive. Those are my three P's, right? So if we do the personalization, and that's incredible. That's probably the most important thing is the personalization, right? That and the participatory. Those are the two most important things because people have to be with this kind of care. This isn't pixie dust. I tell people like you're not going to come in. I'm going to take your stem cells and put them in your knee, and you're going to be cured. Like this isn't that kind of pixie dust. Like you will fail at therapy if you're not optimized,
yeah,
right? I
yeah.
just recently had a diabetic come to me, 7.1 A1C. I'm like, look, your platelets are going to be clumpy. They're not going to release their growth factors. Your
Hmm.
stem cells are not going to release their exosomes, which are the important material that has all the information we need to repair tissue. You're just not going to have a positive response to this.
Hmm.
And I'll never forget this guy because he was blown away. He's like, wow. He's like, well, I just saw someone else a week ago. You're my second opinion. And they've got me scheduled next week for the bone marrow stem cell procedure in my ankle. I'm
Mm.
like, you can do it. I won't because I want you optimized before you do this.
Yeah,
And it's a shame out there when people ask, like, how do I know if I have a good specialist in orthobiologics? Look at their pre-procedure protocol and optimization recommendations. If they don't have any, run. Save your money and find someone else who does. Get a referral to someone else who does. Because those of us who specialize in this field believe in metabolic optimizations before orthobiologic therapies.
yeah.
So
Yeah.
that's an actual term out there that we use. There was actually a paper just published on this metabolic optimization before orthobiologic therapy,
Mhm.
MBOT or something like that. Yeah, but that's how we practice. That's how those of us who specialize in this field practice
Mhm.
because we need that metabolic optimization, not only again to get a drug that's powerful that you're making, but also to have an environment where that drug can have an optimal effect. You know, I had a woman fly in to see me in Washington from Washington D.C. She was a high-powered D.C. attorney, and she found me through a Major League Baseball player I was taking care of at the time. And she has a second home here. So she flew out here to Scottsdale to see me. We did our consultation and I gave her my anti-inflammatory diet and recipes, just a general outline. It's like, look here, pick and choose what you want to eat out of here. Don't eat what you don't want to eat. This is just a guideline to show you how to eat healthy, right? How to make better food choices because that's what it's about. It's not really a diet. It's about making proper food choices to support your biology so we can do these procedures down the line. Well, she got it. She went back to Washington D.C. She emailed me. She's like, "Hey, listen." It's like, "I know we talked about doing this. This was in August. She came to see me, August of 23. She messaged me back in September. She's like, "Hey, I know we were talking about doing this in September, but she's like, I really want to do this diet for the next 2 months." And she's like, I really want to commit to this. I'm like, fantastic. Let's do that. So this is like mid September. She reached out to me like right before Thanksgiving, picked a date to do the procedure in December. She reached out to me a week before she was flying out. She's like, hey, I've lost 30 pounds just eating your wife's recipes and these healthy foods.
Right.
And she's like, my knee pain is 90% better. She's like, my hip pain is gone. We're going to treat her knees and her hips simultaneously, all in one sitting.
Right.
And she's like, I still want to do them because we talked about the potential. So with these biologic therapies, they're not only pain relieving and anti-inflammatory, but they also have the ability to preserve joint health and prevent the breakdown of cartilage and tissue over time.
Right.
There have been studies have done that have shown that, if we do these treatments inside a knee, follow them over 2 years, compare them to steroids, placebo, saline, hyaluronic acid, which are the gel injections. The PRP group, the biologic group, had no loss of cartilage volume, whereas all of the others did.
Yeah.
So we can theorize that, hey, maybe these growth factors we're injecting have an effect to prevent the breakdown of cartilage. So we had that conversation. She comes back, we do her procedure. She does great. So that was December 2023. In the beginning of 2025, January, I got a text message from her. She's like, "Hey, just wanted to give you an update. We're a little over a year out." She's like, "Knees, hips, 100% pain free." She's like, "I'm back to playing polo." She plays polo all over the
Yeah.
world. She's an extraordinary woman. I actually want to reach out to her. I haven't talked to her since that text. She's
Yeah.
like, She's like, your treatment was absolutely brilliant, but she's like, your wife's recipes have been life changing. She's like, my husband's eating this food. She's like, yeah, my kids are eating this food. I've
Yeah.
got all these people on it, and she's like, everyone is like doing so well. Their joint pain is so much better. So it really comes down to like that foundational work. I
Mhm.
bring this up because food is medicine. I've had so many people who go through the pre-procedure protocol,
Yeah.
and their pain gets better.
And
Because
it was business, Osh.
yeah, hey, I'm okay with that. Hey, listen, for me, I tell people like, look, people come to me for a second opinion. They come to me for a first opinion. I tell them, listen, this type of work is bigger
Yeah.
than me. I'm just
Yeah.
a vessel for the higher energy that's coming through. I
Yeah.
believe
I
people
love it.
cross paths when they're meant to cross paths. And I tell people all the time, if it's not my hands that help you heal, then a-okay, as long as you get what you need,
Yeah.
right? Because
Yeah.
this is bigger than us. This isn't about me as an individual person. This isn't about that. This is about, hey, listen, I'm here to share information with you. If I'm your guy, awesome. I will honor and respect you, and I'll go on this journey with you. But if I'm not your guy, I'll help you get to the right place. And I'm okay with that because there are a lot of talented people out there. I'm just one person, right? And I believe in chemistry. I believe in connection, right? And that's why I like spending an hour with each person because we can feel each other out. Like, do we have a connection here? Do we believe in each other, right? Because I can't do anything unless you're in it with me. Again, this is participatory medicine.
Yeah.
This is you got to be a player in it, and you got to believe that hey, I'm a good partner for you.
That's a good point. What we do is participatory medicine.
Yeah.
That's kind of what we do apart from what we've been taught and where we came from.
100%, right? Because if you look back, like I'll
Yeah.
never forget my colleague, even when I was in the insurance rat race, like back in the 2010, 2011. all my friends who were in this would be like, "You get too close to your patients. Like you give, your patients have your cell phone number." I'm like, "Yeah, these are good people, and I want to be available for them. Like, I really want to help them get better." And I was like, it goes against what our medical training is. Distance yourself. Like I got some of my colleagues and some of my really good friends. They honestly don't care about the person on the table they're injecting. It's just numbers, it's numbers, it's numbers, and how many more can we do, and how fast can we get? And the conversation is, hey, I can do 8 shots an hour. How many can you do? Well, I can do 10. I'm
Yeah.
like, I don't think that's anything to brag about, right? I mean, at the end of the day, it's like, these are intimate procedures,
Yeah.
right? When I'm entering a spine, like that's a sacred space, man. That's a deep sacred space that we're going into. And
Mhm.
I've got a lot of respect for that. Yeah, I came from an injection mill, way back when, but now it's a whole different field. Well, my practice is a whole different field, but it is participatory. Like it goes against everything we're taught before because back then it was so passive. Come in, I'll do the shot, and then you're out the door. You don't
Mhm.
have to do anything but stop blood thinner so we don't cause a bleeding issue. Make sure you don't have an infection. That's about all you need to do. You can keep on eating your crap. You can drink and smoke every day. Just show up on the table. I'll do your shot. Your insurance will pay for it, and you'll
Yeah.
get some temporary relief, right? But yeah, but no, but what the type of medicine you and I practice is so different, man. It's
Yeah.
deeper, and we're blessed and fortunate that we can do that.
Yeah, true. Man, awesome. Awesome. So, hey, tell me about, you mentioned we got into, and we may cut this out, I don't know, but that laser thing, let's talk about that because you were talking about what it
Oh
does,
yeah,
releases and everything like that. So, yeah, tell me,
yeah.
yeah, talk
So
about,
photobiomodulation, it's been
yeah.
around since the sun started shining. So, and that's all it is. It's light therapy, right? We need light as beings to survive.
Yeah.
Every one of our cells needs light. Well, smarter people than I figured out that we can harness different wavelengths of light, and they have physiological responses in our body on a deep cellular level. We're talking inside the mitochondria, inside the electron transport chain, in the cytochrome oxidase system. Like,
Yeah.
yeah, it's incredible. Well, in the early 2000s, Italian scientists and engineers developed what's now the MLS laser. It uses two different specific wavelengths of light that has been studied. There's over 400 peer-reviewed studies on this laser in the rest of the world. And what these two wavelengths of light do is they help not only relieve pain and inflammation, but they also stimulate tissue repair and healing.
Hmm.
So in Italy, this laser has been used for wound healing. So if you have a wound, a diabetic wound, or an ulcer that's not healing, this laser can use this light therapy at specific settings to penetrate deep into the wound to stimulate blood flow, to stimulate tissue turnover, and it can actually heal non-healing wounds and ulcers.
Right.
This laser has a fracture setting. So a lot of times I'll see people with like compression fractures in their spine. The traditional pain management route is to put cement in the spine, right? And if you think about this, it can be very beneficial for pain relief. I mean, compression fractures can be incredibly painful and incredibly debilitating. But when you put the cement inside there, it's a methyl methacrylate formula.
This is the kyphoplasty, right?
Kyphoplasty, exactly, right, right. Yeah, you put a big needle in the bone, you fill it up, it seals off the fracture,
Right.
and then the pain gets better within days. It's amazing. But like doing this orthobiologic training I did starting in 2017, we've learned that there's marrow inside the bone, right? And that marrow gets absorbed. And now you're filling that area with this chemical that I don't think any one of us would take a spoonful of and eat, right?
Right.
Yeah, it'd be pretty bad for us. But we're here, we are putting it in the spine, in these fractures, and who knows what harm that's causing long term. We just don't know, right? Because no one's doing that study.
Right.
But with this laser, so I see people who have that kind of awareness who are like, look, I got a compression fracture. It's terrible. I'm using a back brace. I'm doing what I can. We'll use the laser. The laser has a fracture setting that increases the cell turnover and can accelerate healing of fractures. So they figured this out in Italy decades ago, and there's peer-reviewed published papers on this. They've also used it for rotator cuff tears, for tendinopathies, for tendon strains, for muscle tears, for osteoarthritis. In fact, in Europe, in Germany, Italy, France, and I believe the UK now, the laser is covered as part of their healthcare system. So if you have the universal healthcare
Yeah.
that they offer, the studies have shown it's beneficial. So if you like Dr. Peter Veiling, Professor Veiling in Germany, he's founder and creator of that Regenekind program.
Yeah.
He and I were having a conversation. He's like, "Oh, people come in with osteoarthritis. Yeah, well, we'll do the laser because it primes the tissue."
Yeah.
for a biologic therapy. So that's one of the things we use the laser for. People will come in, if they're getting their spine, if we're going to do a spine treatment, if we're going to do a shoulder treatment, even a hand, I inject every joint in the body, everywhere from C1, 2, all the way down to the big toe, a little toe, with these biologic therapies. But we'll prime the tissues with the laser because the laser, in and of itself, is regenerative. It recruits stem cells, it releases the growth factors that summon stem cells to the area.
Hmm.
It releases anti-inflammatory proteins. It creates that environment we're talking about. We're optimizing the environment before we do the procedure. And this is the field of photobiomodulation. So that's our laser that I showed you, the big robotic
Yeah.
laser.
And it also stimulates the cytochrome C oxidase, which
It does.
it makes it makes the mitochondria more robust and all that sort of stuff,
Exactly.
which we have mitochondrial degeneration as we get older is one of the 12 hallmarks of aging, right? But
Exactly. So you
yeah,
can consider the laser as being anti-aging.
yeah.
Just targeted anti-aging. We're going to anti-age your joint with this laser.
A lot of people will be interested in that. I know I am.
Absolutely. It's been a tremendous tool in our
Yeah.
practice. Once people experience the relief and they get better, like they keep coming back. They're like, I want to use it on this body part. I want to use it on this body part. And now our laser runs from 7 a.m. to 4:30, and we're booked out 2 weeks. I mean, that schedule is full, and those sessions only take 15 minutes up to 30 minutes, depending on if we're treating one body part versus multiple body parts. So, I mean, it's incredible. Like, I gotta tell people it's not a quick fix. This type of therapy takes time. Even with the biologics, Kevin, one thing we didn't touch on is with these biologics, it can literally take 6 to 12 weeks before you notice any benefit, 3 to 6 months to say, okay, I'm getting better, and sometimes up to a year before it's profound relief.
Yeah.
So that's how these therapies work. So it's not a quick fix, and the people who see me understand that. Like, listen, this is going to take some time. Now, I do the Regenikine program. I told you, the German program with autologous conditioned serum that has the potential to be a quick fix because we're concentrating a high amount of your anti-inflammatory proteins.
Mhm.
So I have some people after the first procedure, they're like, hey, I'm already feeling better.
Yeah.
Other people, we for that procedure, it's a series of 4 that we do. It's not till maybe about 6 weeks after the fourth one where they start to really feel better. Because again, this is all regenerative therapies. This isn't cortisone, a powerful drug that whack-a-moles your inflammatory cascades.
Right.
Yeah, and so photobiomodulation or the laser therapy works the same way. It takes several sessions. Usually, I tell people give it 12 sessions for more of an acute condition. If it's chronic, maybe take up to 24. So.
So if somebody comes and works with you, it's a 3 to 6 month process.
It can be, and that can be done remotely too. I mean, I've got people who fly in from all over the country to see me.
Yeah.
Typically, they'll spend a week here. I've had people as far as the Middle East who've flown in to see me for these procedures and for these treatments. So we'll do a lot of stuff remotely, where I'll work with their primary care or their naturopath or their functional medicine specialist or integrated medicine specialist, and we'll go over labs and like, hey, look, here's what I'd like you to do. Find a concierge physical therapist that I can communicate with, and work on these things to really optimize your health before you come out. We'll pick a week that you're going to come out. Then when you're here, what that looks like is most people will stay in a hotel, or if they have the house here, a lot of people have a second home here or a third home here,
Yeah.
or they'll stay with a family member if they have relatives out here. I'll do the formal in-person consultation like on Monday or Tuesday. Wednesday will be the procedure day. So they'll usually find out the weekend before. During that week, they're doing hyperbaric oxygen therapies. I've got a concierge medical doctor, Verdinko. She's got a very, very high-end concierge practice, but also has 4 true hospital-grade hyperbaric chambers. So they'll do the hyperbaric oxygen therapy, which has tremendous physiological benefits throughout the body, including increasing growth factors, increasing stem cells, reducing inflammation, just creating that optimal environment. So that's usually, they'll be here for 5 days. They'll do hyperbaric every day. We'll do the procedure on a Wednesday. They'll either do hyperbaric before the procedure or after the procedure, depending on what time we're doing the procedure. Thursday and Fridays, more hyperbaric. I'll usually see them either Friday morning or at the end of the day, Thursday, for a final in-person just to check in. And then everything else is done via Zoom, via FaceTime, or via cell or text. They'll all get my text or my cell phone number, so I'll stay directly in communication. If they're coming from outside of the country, we do WhatsApp.
Yeah.
So WhatsApp is encrypted as well. So, it's relatively HIPAA secured and HIPAA safe. But that's typically how it works. Some people will spend 2 weeks out here, and if they do that, they can spend more time doing the hyperbaric protocol. Other people will spend a month out here. We're very good at accommodating people from out of state or from out of the country.
Yeah. You're doing cool stuff, man. You're cutting edge. I love it.
Thanks, man. Yeah, I love what I do. I love work doesn't feel like work anymore. Now it's like I can't wait to see who I meet today. I can't wait to see this person that we've treated, and guide them along the way. I tell people we go on this journey together, because it's not a quick fix. They come back at 3 months and they're like, I know you told me to hang in there, but I'm not feeling any better. I'm like, I know, hang in there. Then usually at 6 months, that's when it's like, okay, this is what we were talking about.
Yeah. I like the whole deal. I like your setup. It's you're in a great place, and you're doing great work. And yeah, I appreciate your time. This has been. I need to get out there and get some shots of laser. I did my MRI, my full body MRI, which Pronuvo when I was out there, and it really made me look at my spine different. My
Yeah.
lumbar spine. I thought, oh crap, man, I'm 51. I think I got to play things a little bit different. Like you said, working with the right kind of people to as we exercise and things like that. Because I did a bunch of that stuff growing up. You learn to work out by watching other people.
Yep.
Like, oh, that's not the best idea.
Nope, you learn their bad habits. Yeah.
Yeah,
I'm 51 also, man. I'm right there with you. I'm like, I think about all the things I can do for prevention now. It's like, well, I can't undo the severe stenosis in my neck. Like, that's not happening. But
yeah.
I can prevent it from getting worse, right? And hopefully keep it relatively asymptomatic.
Hmm, hmm.
Yeah.
Well,
Yeah.
anything else you want to leave us with before we any other good
Gosh.
tidbits or thoughts?
Food is medicine.
Yeah,
Food is foundational. Sleep is incredibly important for health and healing. Make time to balance your nervous system out, whether that's with breath work, meditation, prayer, whatever you believe in. Just find that time to really just connect with yourself and relax.
yeah.
So incredibly important.
What's next for Dr. Goyle?
Man, we got some cool things coming, man. Like, I'm connected with an incredible team, brilliant, brilliant people that this brilliant scientist has developed a product that could potentially be a game changer for orthopedics. He's taken 3 amino acids, 1 vitamin, and 1 mineral, and figured out an exact ratio to stimulate chondrocytes, which are the cells in your joints to produce collagen. And he's applied this to different types of tissue, including tendons and ligaments. He's introduced us to the veterinary world, and this product can actually regenerate tissue. It's incredible.
You said regenerate collagen. We're talking cartilage.
We're talking cartilage, man. I'm blown away by this, but it's still early. We
That's
just
like
did it.
science fiction stuff,
It's
brother.
like science fiction stuff, man. And you're gonna hear it first. I think my buddy Kevin is gonna win a Nobel Prize for this. Like, it's
Yeah,
unbelievable. It's
yeah.
extraordinary. We just did the safety trial at my clinic last week.
Right.
So he's been using this product. He invented it 12 years ago, perfected it 8 years ago, then started treating his clients. He's a Chinese medicine acupuncture specialist with a degree in biochemistry, cell biology. He's brilliant, brilliant man, brilliant. Like, his brain is on a whole other level, man. Like, I tell people, I told his team, I trained with 10 of the top pain docs in the world.
Hmm.
Leo Caprell, MD, PhD, Michael Stanton Hicks, same, just geniuses. But Kevin's brain is on a different level. Like, he's Einstein level genius, and his knowledge of cell biology and biochemistry. Like, he's got these ingredients, these 3 amino acids, this 1 mineral, and 1 vitamin. It's proprietary, it's patented, but he's got it down to the hundredth of a milligram. Like, these ratios, he's like, it's all about the ratios in this exact formula. And he's like, you can put it in different animals and it's regenerating tissue. It's phenomenal. So anyway, we just did the safety trial in our office last week, and once I can talk about it, I'm gonna rave about this thing, because I had it put in my knee and I had it put in my neck in December, and my range of motion, Kevin, I couldn't do this Thanksgiving Day. I could not do this. I got full range of motion to the right. He did one shot in my neck the first weekend in December. He also treated my knee.
Yeah,
My knee the next day was like 95% better.
yeah.
A week later, I was doing single leg squats with 325 pounds on my left knee, pushing it because I'm like, I'm going to see if I can mess this up. I was being stupid, but
Yeah,
next day, no pain. My quad was on fire and
right.
burned, but the knee, it did not flare. Fine, perfectly fine. So he treated me.
Like, did you get to like MRI it prior, pre and post?
I
Okay.
have an MRI from a couple of years ago, from 2023, but nothing more recent. I'm going to redo my MRI. I
Mm.
want to wait for 6 months because we got to give this time to. But if there's cartilage regrowth, I'm going to be screaming from the top of every
Who's this guy,
building.
Kevin? Who?
Kevin,
It's
he's
okay.
a Yeah. I can't talk too much
I was
about it
going to
yet,
say, I don't want
but
to
but this is the
get
first time I've talked it on a public forum.
sorry. We can cut this out if we need to.
No, you don't have to. No, because eventually it's going to be everywhere. Like,
Yeah, yeah.
yeah, I mean, this is huge, man. It's huge. She's already treated hundreds and hundreds of people over the last 8 years. Not one adverse event, 98% response rate.
Mm,
And we're talking like, so I had a guy come out from California, bone on bone, right hip. He's a former pro tennis player. He made his living in Indian Wells, wherever the community is in California, where all the tennis pros are. So he teaches on a very high level. 8 years ago, his hip got so bad, he's like, I can't teach anymore. I can't play tennis. So he's told his only option was a hip replacement. Somehow he found out about Kevin. Went to Wyoming. Got this. I call it the magic sauce. Got the magic sauce put
yeah.
in his hip, and 6 months later was back full sports, 100% pain relief. So he flew out in December when he found out that I'm now the only one in the world who has access to this because Kevin said you're going to be the guy now. So he flew out. He came in from California in December for the opposite hip because his right hip 8 years later is still pain free, bone on bone. Total only solution is a hip replacement. 8 years of pain free. Like, it's incredible. Like, the potential with this. So did his other hip, but I was blown away. I mean, I looked at both hips under my fluoroscope, my X-ray machine,
Right.
when I was injecting his left hip, and that right hip looks like a disaster. He's like, I have no pain and I have full function. He's like, my left hip has been bothering me. He's like, it's not bad, but he's like, what this stuff did to my right hip 8 years ago, I want that for my left hip so it doesn't turn into my right hip.
Sure.
It's incredible. Yeah, I got more stories, man. I got a guy who flew in from New York that Kevin treated 5 years ago. Same kind of story. I'm like, dude, the world needs to know about this. This could revolutionize orthopedics. And like I said, Kevin's going to win a Nobel Prize for this. Yeah,
Three amino acids, a vitamin and a mineral. But and
that's
then
it.
a peptide plus a vitamin and a
Yeah, exactly. It's made in a compound pharmacy in Utah. 503A, CGMP certified,
yeah.
tested for purity, sterility, all of that, man. Like, it's incredible. It's so incredible. So that's what's new, and that's what's coming up.
Yeah.
Yeah. And I can't wait to share it with you. Yeah,
Yeah.
maybe yeah, once I can, we'll revisit it,
Let's
and
do. Absolutely
yeah.
revisit.
Yeah, but for your clients who are interested in this, I can offer it at my clinic.
Hmm.
It's just a compounded medication. All I have to do is meet them. I'll order it's a prescription medication. I order it. I got direct access to the compounding pharmacy. It comes shipped on ice. It's got the patient's name on it because it's specific for every patient, but it's the same formula. Yeah, so if any of your audience hears this and they're interested in it, I'm happy to talk to them more about it.
Okay. Well, cool.
Simple shot, yeah. It's a simple, just squirt it in there and magic happens.
Man.
Yeah.
All right.
So,
I think there'll be some interest. This is
yeah.
great. This has been great, Osh. Better than I imagined. This is
Right
fantastic.
on. Yeah, no, man, Kevin, yeah, I love talking to you, man. This is fantastic. Yeah. And anytime you're in Scottsdale, then hit me up. We'll hang out for sure, and I'll
Absolutely.
show you what else I'm doing. And if you ever need treated, I'm gonna take care of you. So I'll keep you going.
All right. Thanks, brother. I
You
appreciate
got it.
it. And thanks everyone for listening. And we'll see you guys next time. See ya.
Great. Take care.